In February, Maine saw 5 measles cases, and many health experts at the time were worried that would turn into an outbreak. That didn't happen.
CENTER Maine's Sean Tessler shows us how the state has been able to contain the contagious virus.
2 months ago, healthcare workers were on high alert, seeing the first case of measles in the state in 7 years.
We were taking it very seriously. We were working with our colleagues at St. Joseph's Hospital. We were working with our colleagues at the Maine CDC.
Lead physician at Northern Light Eastern Maine Medical Center, Scott Melton, says the extra attention was necessary because of how quickly the virus can spread.
Unvaccinated persons tend to cluster together. So usually if one person in the family is unvaccinated, the whole family is unvaccinated.
Then in mid-February, Maine saw 4 more cases.
We were kind of amping up, what we're going to do if we start to see a lot of cases of measles. Luckily, it didn't happen.
Since then, Maine has not had another case of measles, something that Sarah Robinson with the Maine CDC says isn't an accident.
People did what they were supposed to, so those people who were exposed quarantined. We have good vaccination rates.
According to the Maine CDC, the state has a childhood vaccination rate of over 97%. Just 10 states have a vaccination rate of over 95%.
There's a lot of measles in the United States and internationally.
In the United States, there were just under 2,300 measles cases last year. This year, there are already more than 1,700 reported cases.
There's so much measles right now that it has been surprising that we haven't seen it until now. We've been very lucky and very proactive to try and keep it that way.
In addition, Melton says he is seeing an increase in vaccine interest.
There certainly was a lot of talk about that, and I think some people were getting vaccinated. Some older patients.
This wave of measles was contained, but the healthcare providers aren't putting their guard down.
As long as measles continues to circulate in the United States, there's a risk that we will see it again.
In Bangor, Sean Tessler, CENTER Maine.